Guys, today we are going to discuss about stroke. Suppose a 60-year-old man came to the OPD, chief complaints of palsy of half of his right half or left half of his body, with the deviation of angle of the mouth and profuse seizures or any activity, or with any comorbidity like diabetes or cardiovascular diseases or any epilepsy, then we will suspect it is a stroke case. Okay, so now today we are going to discuss about stroke. According to WHO, they given certain definition, means it is due to some disturbance in the cerebral function. Okay, focal disturbance of cerebral function which lasts more than 24 hours, leading to death with no apparent cause other than some vascular origin. Okay, so we should distinguish between stroke and transient ischemic attack. Transient ischemic attack is the one which duration is less than 24 hours. So that in history we used to ask OD para, so that we can differentiate between stroke and TIA. Okay, so why which occur stroke? What are the main reasons? Stenosis means narrowing of the arteries, cerebral arteries, or some occlusion due to the thrombus or any rupture of the arteries. Rupture occurs mainly due to the aneurysms. Next is dysfunction of brain. Dysfunction of brain occurs due to coma, hemiplegia, paraplegia and monoplegia, multiple palsy and sleep disturbances. Due to these, there is a dysfunction of brain. Okay, and due to nerve palsy it may be, or sensory impairment. So coming to types of strokes, there are mainly two types of strokes. One is ischemic stroke and another one is hemorrhagic stroke. So why this ischemia is occurring? Why is this narrowing of arteries? Why there is a blockade of artery? Why means there is any infarct present, means lacunar infarct may be present, or there may be carotid arterial obstruction, carotid circulation obstruction there may be, or vertebral artery, basilar artery in the pontine region, pons. So there may be this circulation compromise which may lead to ischemic stroke. Okay, coming to hemorrhagic stroke. Hemorrhagic stroke is sometimes spontaneous intracranial hemorrhage, which may intracerebral hemorrhage, which may occur in some road traffic accidents when the patient fall on his head. It may occur, and sometimes subarachnoid hemorrhage may occur. Sometimes intracranially aneurysms. This is known as saccular or berry aneurysms, intracranial aneurysms. There will be ballooning of artery and rupture of the cerebral arteries. Okay, coming to arteriovenous malformations, there may be malformation of arteries and veins of the cerebrum. Coming to problem statement, cerebral thrombosis is most frequent form of the stroke which follows the hemorrhage. Okay, subarachnoid hemorrhage and cerebral embolism are most likely the cause of stroke and death. Stroke from cerebral hemorrhage is most common in Japan. Okay, coming to morbidity and mortality, 2016 this cerebrovascular disease accounted for 5.78 million deaths, equivalent to 10.2% of all deaths. 20 to 50% die in first month, depending upon type, severity, age, comorbidity and effectiveness of treatment of complications. Okay, they are dying because some severity, age, or some any comorbidity which is associated with this stroke, like diabetes, cardiovascular disease, or smoking, like that. So people who are hypertension, like that. People who survive also may be left with some disability. Okay, lifelong disability, and with mild, moderate or severe disability it may be. Okay, maybe monoplegia or hemiplegia, like that. There will be sometimes complete palsy, like that. So in India, prevalence of stroke is increasing proportionally with increase in the life expectancy. And another which are associated with stroke or rheumatic heart disease. Ischemic strokes may occur in peripartum period, and arteriopathies may occur as a sequel of CNS infection, like in bacterial tubercular meningitis, etc. Okay, coming to risk factors. Risk factors, one is hypertension. cerebral thrombosis may occur as well as hemorrhage may occur in hypertension. Yes, no, as there is more pressure against the vessel walls, there is a rapid rupture of the walls and it may lead to hemorrhage. Okay, other factors may be cardiac anomalies. Cardiac anomalies and left ventricular hypertrophy may occur, cardiac dilatation may occur, diabetes. These all factors also may lead to stroke. Okay, any cardiac dysfunction may lead to stroke, and left ventricular hypertrophy, there is a compromise of blood flow and it may lead to stroke, and cardiac dilatation, diabetes, elevated blood lipids, obesity, smoking, and glucose intolerance in case of diabetes, like that, these all may lead to stroke. Okay, and some blood clotting disorders, if the thickness of the blood means viscosity increases, it may also lead to stroke. Oral contraceptives usage also leading to stroke, but so many people are omitting it due to high estrogen, progesterone. This actually estrogen is good for heart. It will increase the HDL levels, but sometimes progesterone supplements may lead to dangerous effects which may lead to stroke. Okay, risk factors for stroke are similar to that of the coronary heart disease. Okay, coming to transient ischemic attacks. Transient ischemic attacks we had already discussed. These are also focal, but these are reversible episodes, and neurological deficit is seen. Onset we should ask sudden in onset. Duration is very important for differentiation of transient ischemic and stroke, which is less than 24 hours duration, and recurrence is most common because these are transient attacks. Okay, and why these are occurring means microemboli, small thrombus which are migrating, so that we are calling them as emboli. So, and is a warning sign for the stroke. If we didn't treat properly or take necessary action, it may lead to stroke. Okay, what are the host factors means age probably. So persons who are about 60 or 70, it is main risk factor. 1/5 of the strokes in India may occur. Out of 5 patients, 1 patient will be less than 40 years. Remaining all will be greater than 70 years or 60 years. Sex more in males because more smoking, more alcohol habits are seen in males. So higher in males than females. Personal history is associated diseases like cardiovascular system diseases, maybe diabetes, like that. And slowly progressive course, so that we'll ask OD parameter. P for progression, any progression is there, like that, of a generalized vascular disease. Okay, some vessel deformities, it may progress and finally it may lead to stroke. So coming to stroke control program, that is SCP, we have transient ischemic attacks. How can we control? Early detection we should do, and treatment we should do, otherwise it may land up in stroke. Control of diabetes and elimination of smoking should be done. That's all for today. Thank you guys for listening to me patiently. Bye.